tragedy. The exhibition brings to life the story of the Pulse nightclub from its earliest conception through the present day to ensure that you consider going between now and June the 13th. It is free. To Dr. Pino at this time, and then we have
has an accumulative number of cases of 144,000. Average is at 4.1 and continue to decline. Last time, 6 female, 5 male patients. 5, we don't have that information. The individuals for 9% was a resident. You are going to notice a decrease in the percentage, just slightly. It's an 18 individual, the same population, nice, and that is 40 locations that are offering vaccines in our parts. Those are very close to our communities. And also mental phase until the 18th. After that, we will decide if it's to work on shift 24 hours a day, every other day, and other locations around the world. But it will also, so the CDC has we will in yellow a couple of days this week. The levels are substantial with orange, moderate with yellow, and then for those who want to continue to be in touch with the health department through social media, remember.
Yes, tooth dropped 97%. They essentially disappeared last April. So the April before that, the last pre-pandemic April that we had, we still have a way to go. That's also, quickly we would have our chart on the screen behind 19. It's about flat through 2020, and then it drops up. And, you know, looking at these numbers, whether it's on over the past year, could rival the rise. Very positive vaccination. The immediate future looks very promising. DT shortfalls for the month of April, reserves of information that we've provided to you, and we'll be happy to provide center and funding of the convention center 30 days since the beginning of the pandemic and that's been taken out of reserve.
Okay, just as a reminder, if there are special assistance questions that you may have at this time. And while they're getting it, will be back at county.
News. Just wanted to get your personal thoughts now that things are seeing Orange County kind of return to normal a little bit.
I think relocated from other communities who are not yet reopened, I believe April of 2021. So Comptroller Diamond gave that we have numbers for, but the main numbers will be the bookings that we have now through bringing in $178 million of economic impact on our community. It makes me feel we are at this point. So that's the good news. And Dr. Pino, that's a lot for our residents to look up to. I believe that it will create job back working where they were primarily.
Lauren Seabrook, Channel 9. My question's for Dr. Pino.
I could have
longer be issuing the COVID case numbers and deaths daily, just once a week. Say to those folks who want to know why they're not able to see those numbers.
Orange County will continue to have daily pandemics moving, in the sense that we are, many of the emergency operations of the states are also scaling down local capacity, so our numbers will continue to be daily. We continue to have executive they need. That's necessary.
well. And so we'll go back to the Q&A.
Airport and offering them not going to work and
intended for travelers. And I say we're given, so we are expecting that to increase. We don't recognize the people that are coming into the county. They're setting us as a pilot until the 18th, and they want to get to the hotel. The dynamics of an airport environment where you have to arrive 2 hours in advance, vaccinate a traveler, that's absolutely fine. At this point, we have an excess of vaccines when we only are vaccinating about 54%. So that's the intent, but it's not in.
Fox 35. So the county recently launched this needle exchange program. What are the goals of this we've seen with, what would you say to someone who maybe questions?
Dollars can be used for that. So the goal is to reduce the contract venereal diseases and other things, and we have seen a slight spike in the needle exchange program as a hook to get individuals into these within our community. So it's really at this phase, it's a pilot and even drug usage. Obviously, you did comment about as we respond to drug overdoses, you know, there's a criminal element associated with addiction. And so the needle exchange program is a proactive measure that we have. Other questions?
This question is for Mr. Diamond, Troy Campbell with Channel 6. For our TDT, what month do you think we'll get to when we no longer pull from that reserve?
It's about 145 million since this all started. And Convention Center, as far as how soon we might go, hopefully very soon. I think if we have another month like.
I think the worry is that people continues to be. I would urge an unknown sizes that we have today that we're still not here. You heard the numbers today. Continue to put.
I share the same concerns. Patients among the older here, 77 for 65 plus, and 17 have a huge gap. They made the whole decision for those school into congregated settings, and it's critically important that they are immunized.
Just a couple of things. First, we're all vaccinated in my family, but I hope everybody else will consider. Will still have some impact in the economy, some impact from the standpoint of TDT, which might be what you're at. People getting healthy, if everybody's had of other really bad months, it's starting to turn around now. You know, you might remember after 9/11, we had a 33. Keep in mind that we've got a long way to go to get back to where we were. We've got to get along. Something I worry about. Something last year, Mayor Demings started. And I think if that decision hadn't been made, we'd be looking.
Importante lo que acaba de mencionar sobre desde otras partes de América del Sur. Los familiares en esos países donde esto va a ser una gran noticia, creo yo, en lo que es la población hispana, a funcionar esto un poco que esta noticia va a caer fuerte en la población hispana.
So the question from Latin American countries in English, and then I move to Spanish. Para responderte en español, al día 18 de junio, el aeropuerto es grande, y también recordarle en algunas de las aerolíneas, y queremos mitigar que eso pase en el futuro, es parte de esa recuperación. Y no es la intención, pero no vamos tampoco, tenemos un exceso de vacunas.
Ron with News 30, dominant strain in some parts of the world, and of course this. So what's the current level of concern based on what you've read?
So the concern that we have with the variant, what the answer before for people from we vaccinate them in the future. And again, although people of young age have the